Welcome to Scrub In, a podcast powered by Bay Health. I'm your host, Sarah Beebe.
And I'm your co-host, Tyler Cody.
Step into the studio with us as we scrub in and dive deep into asking, what is your why? A conversation committed to inspiring purpose in each other.
Here we offer personal and practical lessons directly from our community members that unite, grow, and empower us all.
Right. Well, welcome to a special edition of Scrub In, powered by Bay Health. I'm Sarah Beebe, one of your hosts, and I'm here with
Tyler Cody. How you doing?
Tyler Cody. And then we have Brian from the Delaware Healthcare Association today, and we're so excited to have you. Thank you for being with us, Brian.
Thank you so much for having me. I'm happy to be here.
Yes. So we always start all of our episodes with a quote. And so today, our quote comes from Hippocrates, which is appropriate here. And whenever the art of medicine is loved, there is also a love of humanity. And so we're gonna start with that today. So Brian, we are so excited to work with you. Tell us about yourself. What do you do for the Delaware Healthcare Association, and kind of what's your background?
Sure. Thank you so much, Sarah and Tyler. I really appreciate the opportunity to be here with you today. So I'm Brian Frazee. I'm the president and CEO of the Delaware Healthcare Association. Our association represents Delaware's hospitals, health systems, and healthcare-related organizations. So my primary job, along with my team, is to effectively represent and advocate for the hospitals in Delaware and the patients that we serve and communities that we serve.
Awesome. Now, Brian, how did you get into that line of work? Where did you start?
So I got my start in Maryland, actually. I was a lifelong Marylander until I moved to Delaware for this position about 7 months ago. Very happy to be here and proud Delawarean. I really got my start in politics back in when the Affordable Care Act actually passed at the federal level. I happened to be working for the chairman of the Senate Finance Committee in the state of Maryland at that time. And the Senate Finance Committee in Maryland has jurisdiction over healthcare issues. And so I had a front row seat to all of the work that the states needed to do to effectively implement that law. So that's when I got my interest in healthcare. I had always been interested in the political process and policy. So I then went to work for his campaign and ran the Democratic coordinated campaign in Southern Maryland. Then I went to work for a contract lobbying firm for a short time, and that's when I got introduced to advocacy. And then I spent 4 years working for the Maryland Association of Community Services, which is the statewide association for providers of people with developmental disabilities. Spent 4 years there and then worked at the Maryland Hospital Association for 8 years as their government affairs lead before coming to Delaware. So I have a unique blend of politics, policy, healthcare, and association experience that led me to this position. I'm very happy to be here and grateful for the opportunity.
Yeah. Oh, that's interesting. So, we ask everyone on this podcast what their why is. So, why do you do what you do? What's your inspiration?
I love that question. I think put simply, my why is people. There is no better or more people business than what I do, in my opinion, in the association world, because I represent a diverse set of members that have a lot of different people within the organizations. I also have to interact and advocate to a number of different policymakers of both parties in the governor's administration, at the federal level, at the local level, the state level. And so when you work for associations, you're kind of in the center of a lot of different dynamics that you have to manage. And what that requires is balancing a lot of different ideas, perspectives, landscapes, and people. And it's all about people. It's all about the relationships and the people that we serve. And that really is my why, and that's what drives me every day, is the people who are on the front lines of care in the state of Delaware, the people who are supporting our frontline providers, and the people that are advocating for them, like my team and I, on a daily basis. So that's what keeps me going. And I will say that there was no better evidence of that than during the pandemic, of course. I was in Maryland at that time, of course, working for the association there. And the things that I saw, the things that I experienced and saw firsthand and heard about were just some of the most inspiring and difficult moments of, I know, my life and many other people's lives, and just really reaffirmed why I do this work and why I like to advocate for, hospitals and health systems and the communities that they serve.
Yeah. Oh, I can only imagine that you probably went home every day like with some either wonderful or devastating story that probably affected you outside of your job as well. I can imagine that may have been difficult to turn off at times.
Absolutely, absolutely, and it would, but I also, yes, the short answer is yes, it definitely was difficult, but I will say that I was always cognizant of the fact that I wasn't on the front lines, so I can't even imagine what the folks that were and actually had to see and experience and work on these things, what it was like for them, and that really got me through. When I had my own personal moments, like all of us did during that time and that crisis. But it was important to keep that perspective in order to get back to what your original question about what is your why and why are you doing it. It's really just all about the people at the end of the day.
Yeah.
Very well articulated why right there.
Yeah.
Definitely.
Tyler is an ICU nurse, so he was at the height of the pandemic. And were you in
Yes.
management during?
No, I was actually at the bedside at the time.
Okay.
I was the shift supervisor. So definitely a lot of crisis constantly. But I enjoyed the fact that you articulated your advocacy as your why and people being the justification for your passion in healthcare.
Thank you so much for sharing that, Tyler, and thank you for all that you do and all that you did during that time and continue to do, to this day. We really appreciate it.
Thank you.
Yeah. Now, I assume that you are not the president and CEO of DHA all the time. What do you do in your off time?
Sure. So I have three young daughters. I'm a girl dad. My youngest daughter
Okay.
actually turns 2 today. My middle daughter is 3, almost 4, and my oldest is almost 6. And so my free time, the limited amount that I have, is dedicated to them and my wife. So I like to spend a lot of time with them. I like to read political history books and biographies, and I also like to watch comedies. I would say that's what I like to do in my free time.
Okay. And you are busy as a girl dad.
Yes, very, very much so. So there, like I said, there's not a lot of free time to go around, but that's okay.
Yeah. Yeah. I'm the opposite. I'm a boy mom. So the same
Oh,
thing.
really?
Nobody stops moving in my house at any given time.
I understand. I
Yeah.
understand. That's great.
Awesome. Well, another major reason that we brought you on today, and the reason we have a special edition of this podcast, is because we want to know a little bit more about House Bill 350. So, here in the state of Delaware, anyone who is working in healthcare and anyone who has looked at a newspaper or a billboard knows that this is something that's really affecting our entire state, and we're all kind of curious about House Bill 350. And so, can you tell us a little bit more about that and where we are with that piece of legislation?
Sure. Thank you, Sarah. So, House Bill 350, as you all know, we are fiercely opposed to it in its current form. It's been quite a process over the last couple of months since we first learned about it at the beginning of March. But let me start by saying that we've made very clear from the beginning that we share the sponsors' concerns around healthcare costs, and that's because we're feeling it too. Whether it's pharmaceuticals, general inflation, labor expenses, things have just gotten more expensive over the past couple of years. And we're also making critical investments, all of our members, in expanding access to care because Delaware is a growing state. As you know, we're an aging state as the fifth oldest population in the country. And so we really need to beef up our infrastructure in order to keep up with the demand of our residents and make sure they have adequate and quality access to care. So we've made that clear from the very beginning and look forward to working with the sponsors on those issues. But what's in front of us right now is a bill that we think would actually put us in the opposite direction. And the reason for that is well, there's a couple of different reasons. I think first and foremost, there's a provision in there that would mandate that hospitals not charge more than 250% of Medicare rates to commercial patients in 2025 and 2026. And that arbitrary cap would actually create an immediate $360 million cut across our 5 adult acute care hospitals. And that would really have a catastrophic impact on access to care. We're talking about, people and programs, service lines. When hospitals are operating at a negative 2.55% margin last year, there's not much room to cut. And so having that on top of it would just be simply catastrophic for Delaware and for the people that we serve. The other reason we have grave concerns about the bill is the way it's structured in terms of the oversight of hospitals. So I think the sponsor's intent, as far as we understand, is to create accountability around our Delaware's healthcare spending benchmark, which is a mechanism that we and 8 other states, there's a total of 9 states that have this around the country, use. Now, hospitals are only one piece of the healthcare benchmark. We don't control all of the spending within that, but they want to hold us accountable to that to that metric, so to speak.
Okay.
And they want to do that through a group of paid political appointees. And what we believe is that would really take away the authority of our local community leaders serving on our nonprofit hospital boards and give it to a politically appointed board. And we just think that that's the wrong model.
Okay. All right. So the one thing that I've been struggling with for this bill, so I am a nurse researcher as well as an educator, and so I'm always looking for the evidence that supports whatever we do in healthcare. Everything we do is supposed to be evidence-based and, based on the best research and data. So what is the data and evidence that's supporting this bill?
So from the sponsor's perspective, you mean, Sarah?
Yeah.
Yeah, so they point to a lot of data that indicates that Delaware healthcare costs tend to be higher than other parts of the country.
Right.
And that is true. We do have high healthcare costs here, and a lot of that is because of our aging population. Again, we're the 5th oldest state in the country. We're growing. We also are not a good state in terms of recruiting and retaining physicians in particular, and so there's a lot of work to try to address that, and there's initiatives to try to correct that.
Right.
And the other reason too is that again, pharmaceutical costs have risen dramatically, labor expenses, other expenses that we're having to deal with over the last couple of years. And it's expensive. So that's why we share the concerns and really want to make sure that whatever model is put into place is going to work without restricting access to care and quality of care in Delaware.
Yeah. And this particular bill is similar to what they did in the state of Vermont. Is that correct?
That's correct.
And how has it worked for the state of Vermont? Do we have enough data from Vermont to be able to make an educated decision based on how they're going?
We do. And from our perspective, it's clear that the Vermont model is not working at all. When you look at when it was established over 10 years ago, they still have high healthcare costs in Vermont. Their quality has declined. They are not expanding. Their population also doesn't look anything like Delaware's. They have a 94% white population in Vermont. They're not growing. We have a lot of rich diversity here. We have an aging population and a growing population. So it's just a very apples to oranges comparison in really every way. And we haven't seen the outcomes that the Vermont model was intended. And the other problem that, from our perspective and the conversations we've had with our colleagues up there, is that there's very little collaboration between the board, the Green Mountain Care Board, and the hospitals. And that creates a very difficult dynamic when you're making critically important decisions about care, access, growth. All of those things that right now our local community leaders are deciding with the leadership of the hospitals. And that's where we really want that to stay. The other thing I would say to that point is that no other state is considering the Vermont model because it's not working. And so what other states are considering are more enforcement and regulatory authority around their benchmark. And so that's the alternative that we have put on the table for the sponsors to consider. There's precedent for that, and we're united as a membership in terms of coming to the table to have that discussion. We've had some positive conversations in the last few days with the sponsors and are actually meeting with them later today. And I'm hopeful, given our shared concerns and the same goal that all of us have, that we can get to a better place.
Okay. Yeah. And, it just doesn't seem like it jives with what we're trying to achieve for our state. We've worked really hard to improve our outcomes, our health outcomes here in Delaware, our outcomes for populations that have historically not had good outcomes. And then also the fact that in Delaware, we're a community. I mean, lots of other states are so big that you don't know everybody across the state. But in our state, we do know everyone. And a lot of the members of our hospital boards are volunteers. And they're also, a lot of them are donors, and they've supported our organizations and our hospitals for many years. And if we have an oversight committee, their jobs become less important. And I really worry about that. I worry about where you're going to cut cost, because there's just not something that we can't control how much meds, equipment, supplies cost. I mean, it just is what it is. We pay whatever the companies tell us to pay. And so really the variable cost comes down to staff, and then also resources, access. So closing offices, or not having clinics that we once had, or trying to work with fewer people. And that just, I mean, I feel like we saw that in the pandemic when we were really short-staffed and people were out with COVID, and it feels like we'd be moving backwards as.
Yeah. And I think about this also in the scope of how we're growing so much in the state of Delaware. I mean, you see a new community go up every day. You see a new community.
Yeah.
And just, I wonder about the implications of this bill on our growing state.
Yes.
Absolutely. Those are great points. And I'll say too, and you two know this perhaps better than I do. Like I said, I'm a relatively new Delawarean. But I think from my perspective, one of the special things about our state is how diverse it is despite being such a small state. You have urban areas, beach areas, rural areas, suburban areas. There's a lot of different types of needs of the different communities that we serve. And so that yet another point to what we're talking about around, those local community leaders really should be making the decisions about, what is best for their community and what that community needs versus a statewide politically appointed board.
Yeah. And coming from an area, so I now run the simulation center at Bay Health, and on paper, it may look like a spending source of the hospital that may not be necessary because I'm not providing direct patient care. But and that's something that, working in the hospital, we know is vital, because my department saves the hospital significant amounts of money on lawsuits and safety measures, and then also getting staff up and running quickly and effectively, and making sure that our physicians and our nurses and all of our clinicians are the safest and the best clinicians that they can be. And that's the nuance where I feel like an oversight board might not see that, because I am a cost center versus a revenue maker. But at the same time, I'm, in 1 week, I calculated a couple of weeks ago that, my department potentially saved the hospital a few $1 million because we ran simulations, we identified some issues, we corrected those issues, and the patients were never affected. And we have safer practices and measures in place just because of that, and so, those are the things that you don't think about when you think, oh, we've got to cut healthcare costs.
Absolutely. That's such an important point, Sarah. And those upstream investments are so critical to the health of the communities that then help save money on the back end, to your point, because people would need less hospital care, less health care, because they stay healthy up front. And all of that work is so critically important that you all are doing. That we spend nearly $1 billion a year collectively as an industry in Delaware on community benefits for things like that. And those programs are so critically important when it comes to health equity, the health of communities, all of that great work that you all are doing. Is just really, really important. And you're right, it doesn't always generate revenue, but it's a critically important investment. And it's also the right thing to do, because we serve our communities as nonprofits. That's our mission, the mission of of our hospitals, and I'm sure, and if I am allowed to ask you all what your why is, I mean, I'm sure that's part of your why as well, right? Is supporting your patients and communities.
Absolutely, yes. We both. Well, I can't speak for Tyler. I know your why, but I went into education because I wanted to train and support the staff and the clinicians that are new starting out, but then also the existing ones, and to identify issues that can be corrected through training and evidence, and so I mean, that's so important to me to it is amazing to run a simulation where we identify some things that could be a direct effect on the patients, and we're able to correct them in simulation and never reach the level of the patient. Like, it's really nice to know that we did it in simulation and it never happened with the patient, or really, scary situations that we have to be prepared for that maybe only come around every once in a while. We practice them regularly in simulation so that we're ready for our patients and our community when the time comes. So yeah, that's really important.
Things like that, they're not just an expense. You have to think about the perspective of we're continuing to train and grow our workforce, and things like simulation and education really are the essence of that.
Great. And all of our hospitals in Delaware have also invested in graduate medical education, so bringing new physicians to the area and supporting the new physicians so that hopefully some of them stay and we have fewer issues with access. But that is an expensive endeavor, and requires a lot of work in the front end so that we can reap the benefits of it in the back end, which is tough to understand when you're not living it every day.
Absolutely. Absolutely. Yeah. And thank you all so much for everything you do. These are such great examples, again, of the great work that our hospitals are doing. And one of the things that we work on at the association, just kind of aside from this bill that's in front of us, is making sure we're telling those stories effectively, and to the public, to policymakers, because they're really important. And it's important that everyone sees that great work and appreciates all the great things that you all are doing to support your community. So thank you.
Thank you. So that brings me to my next question. What can people in our community do with House Bill 350? So we've told them about it, it's on every social media platform. It's, we're trying to get the word out to our community, but what can our community members do regarding House Bill 350?
Yes, that's a great question. Call and email your local legislators and the governor and ask them to work with us on an alternative that makes sense for Delaware. Because again, we share their concerns. We want to see something happen here, but the bill as currently constructed is just untenable from our perspective, and we're hoping that we can come to the table and work out a resolution. But I would say, vote no. Encourage your legislator to vote no on the current version, and urge them to continue the conversation with us on a better path forward.
Okay. And so the plan, currently where the bill is, so it's being heard in the Senate this week, which is the week of the 6th of May.
Correct.
So it's okay. And so, and then when would it potentially be voted on?
Yep. So as of right now, it will be considered in committee tomorrow, Tuesday at 4 o'clock. And then the floor vote, the full Senate will take it up. That part is unclear, but we do expect that it may be as early as this Thursday.
Okay.
But we're still waiting to see what the leadership decides to that effect. But right now we're expecting it to be on Thursday.
Okay. All right. And tomorrow, when the committee hears it, which tomorrow is the 7th of May, just in case that you're listening to this at a different time,
Yep.
can people go to Legislative Hall? Can they express their support or opposition to this bill in person?
Absolutely. And I would encourage them to do that. Come to Legislative Hall in Dover, meet with your legislator, attend the committee hearing. There's plenty of space there. We'll have a lot of people attending because there's a lot of interest. And we're all on the same team trying to get this to a better place. So yes, absolutely. All of the above. Call, email your legislator and the governor, and show up in person if you can, even better.
Okay, great. I will say this is something that at least in the hospital world, it has certainly brought a number of us together. It's something that we all agree on. And one thing that I heard yesterday, which just really didn't sit well with me, is that somebody said, well, but I feel like all of a sudden the CEOs of the hospital are interested in this, but they weren't interested before. I feel like this is something that we're all coming together on, and the CEOs are concerned for their people. I feel like for us at Bay Health, we have Terry Murphy, and I know that he's losing sleep at night because he's worried about us and about the mission and the vision that we have as an organization for our community. And so, and the same is true for, those of us throughout the organization, and who really want the health of Delaware to be the best that it can be. And so, yes, please support this this cause, and yes, call your legislators and tell them to vote no on this bill. Is there anything that we missed? Is there anything else that we need people to know about?
I don't think so. You all did a great job covering it. So I'm happy to answer any other questions that you have. But no, I think that that about sums it up, and just really appreciate all of the engagement. It's been so inspiring. We talked about the pandemic earlier, and how that kind of related to my why. And I'm kind of feeling like I'm experiencing that in a different way with this issue, because it's been so amazing and inspiring to see so many people that are doing such great work like you two get engaged in the legislative process and support the effort. And to the last point that you made, Sarah, we're all on the same team, whether you're a CEO or any role that you have within the hospital industry, because we may all have different whys, but at the end of the day, we're all in this for the same reason, which is to be mission driven as nonprofits and support the communities that we serve. And so, we're hoping that teamwork that we've demonstrated will translate into a positive outcome at the end of the day.
I agree. That's why we do this podcast, because we know that everybody has a different why, but we all have essentially the same mission, regardless of whether or not you're at the bedside or in administration or marketing, or, we all are here for the patients in the community.
What a better time.
Absolutely.
A united front as well.
Yeah, absolutely. All right. Well, Brian, thank you so much for joining us. This was wonderful. I'm so glad that we got this scheduled, and that we can get this out to the community so that they can maybe learn a little bit more about HB 350, and also about you and what the DHA does. So I appreciate that. Thank you so much.
Thank you so much, Sarah and Tyler. This was great. I really appreciate the opportunity.
Yeah.
Thank you for taking the time to talk to us today.
Thank you for joining us. Please make sure to like and subscribe by hitting the plus or follow button. You can follow us wherever you get your podcasts.
And remember to stay committed to the why.